Thank you very much, Representative Tonko. Thank you for bringing this issue alive this evening and for giving us this time to discuss this. Many thoughts went through my mind today as this vote and the debate went along. And as it was debated by our Republican colleagues, I just couldn't understand where they were coming from. What would motivate them to want to destroy Medicare and Medicaid? Why would they do that? The thoughts just reeled through my mind, and I'm going, I guess maybe they'd had a different experience than I did. I was a young boy in the 1950s, and there was no Medicare, and there was no Medicaid. And I remember my father, he was a rancher. We grew up in a ranching area up in the foothills of California in the Mother Lode Gold Country. And he took me one day to the county hospital. And it was one of the most horrible moments I can remember as a child, because the wards, there were just a ward, maybe 20 or 30 very elderly men, and on the other side, elderly women who were dying. Their medical care wasn't available to them. And sometime later, maybe another month after that, he took me. We were out chasing cattle that had gotten loose, and just a young man. And one of our neighbors we came upon the neighbor and asked where the cattle might be, and he said they were down that way. But he had this huge growth on his mouth. And my dad asked about that, and he said, it's cancer. He had no insurance. He had no care, and he was probably 70, 75, 80 years old. And he died shortly thereafter. In 1965, this country did a remarkable, beautiful, wonderful thing. We gave to every senior in America medical care, doctor and hospital care, the opportunity to live longer, to have that cancer treated, to eliminate those wards in the county hospital where people simply were warehoused to die. And here today, for the third time since January of this year, the Republicans have put forth a proposal, and hopefully it will never become law, to terminate Medicare. Have no doubt about it, Mr. Tonko. They would terminate Medicare. As you said, they turn it over to the private insurance companies with a voucher, insufficient to pay for medical care insurance from an insurance company today. The discrimination that exists in insurance for people with pre-existing conditions, and the paramount pre-existing condition in America is age. If you're 60, 55, 60, 65, you have a pre-existing condition. It's called age. What will come of those people? What is this nation all about? Who are we as Americans? Who are we as Americans? On this floor, in a charade, in a falsehood brought to America today and twice previously, legislation that doesn't deal with the fundamental issues of the budget, the tax issues, the revenue side of it, real reform in the programs, whether it's Medicare or the military, real reforms. No, just cut, slash, burn, and take your seniors. Toss them aside. This is not the America that I want to live in. This is the America of the 1950s, when there was no Medicare and when seniors were in wards left to die or no care at all. Every American 65 years of age is guaranteed a comprehensive health care benefit. It's called Medicare. And whatever else we stand for, that's where the Democrats stand. We will fight this fight. We will not lose this fight. This is about the very heart and soul of this nation. Mr. Tonko, thank you for these moments.
Well, I think it's important for us